Tonight, a new push in Siouxland to help seniors stay safe in their own homes. Now, this comes after local health leaders say one everyday danger is sending far too many older adults to the hospital, those at risk of falling. According to the Sioux City Fire Rescue, the department is already exceeding the number of fall risk calls compared to this time last year. So as of today, July 1st, Sioux City has received 5,068 calls into that department. In January 2025 to July 1st of 2025, Sioux City Fire Rescue was at 5,022 calls. So Sioux City Fire Rescue received 10,222 calls for the entire 2025 year. KTIV's Jacqueline Aragon spoke with local health leaders about new funding coming in to help prevent those at risk.
It's a huge risk of our community members here in Sioux City.
The Siouxland District Health Clinic is rolling out new ways to keep our elderly safe here in Siouxland, thanks to the new Community Challenge grant from the AARP to focus on fall prevention in Woodbury County.
Respond to assisting seniors.
The $2,500 grant will be used to prevent those at fall risk and bring more awareness with fall prevention education and home assessments to remove fall hazards.
If there are stairs, look to see, is there night lighting or look different lights around the stairs? If it's rugs that need to be replaced with no slip rugs, different things like grippers or grab bars in the bathrooms.
Siouxland has one of the highest age-adjusted rates of hospitalizations for falls in the entire state.
There's, a couple thousand people that fall each year here in Woodbury County, with again about roughly 350 of them reporting to actually have to be hospitalized for their falls.
Which is why the Fall Prevention Coalition was created just last year.
So we knew that we needed to do something about that.
We see a lot of individuals and we assess their risk of falls kind of from the beginning.
Megan Nelson, director for Rock Valley Physical Therapy, is also part of the Prevention Coalition.
50% of our patients are at least a high-risk fall.
Nelson has experienced firsthand how a fall can affect a family member, both at the doctor's office.
We do see it a lot. We see it every day with many patients, and we do our best to educate them.
And at home.
My mother, as a matter of fact, sadly had a fall in her home. And 1 week following her fall, she passed away. And she sadly passed away too soon, and that fall could have been prevented. This is a real life thing that happens.
Anyone interested in learning about the grant or looking to join the Fall Prevention Coalition, we have more information on our website at ktiv.com. Jacqueline Aragon, KTIV News 4.
All right, Jacqueline, thanks. And the Fall Prevention Coalition is also urging groups, organizations, and schools to reach out for a fall prevention presentation to just bring additional awareness. And you can find that information, as Jacqueline mentioned, it's inside the story on ktiv.com.